15 participants right now.
Okay. Well, I think we're going to go ahead. Let's go ahead and get started with that. And let's welcome everyone to this inaugural presentation of the McSwain Trauma Education Project, Thursday Trauma Talk. This evening, what we're going to do is we're going to probably go a little off script here in the idea that we're probably not going to do trauma talk per se, but what we do want to do is we want to introduce the McSwain Trauma Education Project, or what we refer to as MTEP. In there, you'll hear us use that. And again, it's medical, so we're going to use acronyms as we go through here. And there, hopefully everybody can see the screen. Some of the things that we want to talk about here today is we're going to have an introduction and overview of the McSwain Charitable Trust, which you'll see referred to as MCT, the McSwain Trauma Educational Project, or MTEP. We'll talk about the mission, the vision, the goals. And the way that we're going to do this evening is it's going to be an open interactive discussion with board members of both the McSwain Charitable Trust and the McSwain Trauma Education Project, excuse me. All of you are all the participants in here today. If you have questions, comments throughout here, please use the chat feature on the dashboard down there, and we'll address those as we go throughout the program and all. But again, we want this to be fairly relaxed in there as we go along. So with that, what I'm going to do, and again, most everyone will be muted throughout the program so that it decreases on some of the background noise in there. But again, as we go through this, always feel free to make any comments or questions in here, and we'll address them as we go through. So with that, what I'd like to do is I'd like to introduce to you the members of both the McSwain Trauma Education Project and the McSwain Charitable Trust group. And the first one we're going to start off with is Miss Mary McSwain. Miss Mary McSwain is the MTEP Executive Director, and she's also a trustee on the McSwain Charitable Trust. Next, we have Dr. Allison Smith. Dr. Allison Smith is a surgeon working in the New Orleans area, and she is also a trustee of the McSwain Charitable Trust. Dr. Lance Stuckey. Dr. Lance Stuckey, again, is a paramedic that became a trauma surgeon, works in the New Orleans area, and he is the MTEP Medical Director. And unfortunately, Dr. Stuckey is not going to be able to be with us this evening. We have Will Shaplow. Will Shaplow is the MTEP chair, and he's also a trustee with the McSwain Charitable Trust. Jared Kimball. Jared Kimball is our most recent addition to the McSwain Charitable Trust, and he is an at-large board member. Miss Madison Noble. Miss Madison Noble is a conference coordinator who we keep fairly busy here throughout the week, and you'll hear from her as we talk about some of the conferences here this evening. And then bringing up the rear, as always, I'm Steve Mercer. I serve as the MTEP treasurer, and I'm going to be your facilitator this evening as we go through here. So with that, and again, first of all, we want to welcome all of our old friends and all of our new friends that we're going to have here this evening as we continue in here. But to begin with, let's spend a little bit of time. Let's talk a little bit about, spend a few minutes just talking about Dr. McSwain myself. Some people know Dr. McSwain. Some people know Dr. McSwain quite well. Others maybe have just heard him or maybe have not known about him. So if we could spend a few minutes here, tell us a little bit about, from the panel group and everything, tell us a little bit about Dr. McSwain and some of your personal involvements with him. And I think we'll start with the obvious. Let's start with Mary.
I am my daddy's daughter. I kind of don't know what to say. He introduced me to EMS. I took my first EMT ambulance class at 17. He's my daddy.
Yep, very good. Others, Will, how about a couple words, regarding Norman?
I knew about Norman. The first time I met him was at a conference, and there were a lot of people there, and I didn't get to spend much time with him. But then we were thrown together working on courses, and it became really clear to me that he was really a friend of pre-hospital care providers, and was deeply motivated to try to make their lives better and to put them in a situation. We'll talk about his mission and stuff as we go on here, but I was telling the gang the other day, we were getting ready for this, that there's two things. We're all familiar with him challenging you to tell him, what have you done for the good of mankind today? And he fully expected that answer. You weren't able just to say, yeah, hi, or something like. He expected you to tell you what your contribution to the world was for that day. But prior to that, you would get hate. And when you heard that, and you looked up and saw him, and he's looking right at you, you knew he had you. He was there to listen to you. He was there to engage with you, and you were about to have a conversation that both of you would remember. And I think that, to me, began what ended up being decades of working together to try to create content, in his words, to build the fund of knowledge that would allow people to make good decisions. And we're still doing it.
Good, thank you. Also, Dr. Smith, I think you were telling us the other day, even the first time that you met Dr. McSwain, and other people that know Dr. McSwain will understand where you met him the first time.
Yeah, I actually met him when I was a first-year medical student at a bar on Frenchman Street, and he came up and started talking, and I had no idea what a giant he was in his field, and how I came to know him, professionally as well. And he inspired me to want to be a trauma surgeon, something I thought I would never have had any interest or ability to do. And he definitely was very supportive to me throughout my medical school training and starting residency and everything. So that's how I got to know him, and I'm very grateful to him. And I try to carry on what he taught me in what we do every day in the trauma center.
Well, and as Will indicated, we are going to talk a little bit more later on here about Dr. McSwain's vision and missions in life, and the things that he held dear to him. One of the things that I got involved with Dr. McSwain early 1980s. I took a program on trauma care of the patient that Dr. McSwain was at, and there was a couple of issues in there that I thought could be beefed up and enhanced to make the program better. So back then I wrote a letter. Yeah, and yes, back then we actually wrote letters in there and put it in the mail to Dr. McSwain, and he actually responded back and he said, thank you for the comments and everything. Now, you're going to help fix that. And also, one of the great things about Dr. McSwain was the ideas, as people alluded to and everything, is that he wanted to hear from everyone, and everyone had a say and an involvement in there. And I think that's one of the things that continues his legacy as we go through here, and help mold some of the things that we're going to talk about this evening here in regards to MTEP and things in there. But one of the things that, and those of you that have been around for a while, one of the things that I've always found interesting was this: McSwain's rules of patient care. If you've been around, I think this is something that has a lot of application in today's environment, not just, for all different levels and everything, but I think there's a couple things to, if you have not seen this before, I think it's well worth your time, and it's something that's available from our website in there. But Dr. Smith, if you could talk about this from a surgeon's perspective in there, because I think the way that you read it is in one direction, but then I'm going to ask another individual about their perspective on it from a paramedic viewpoint.
Yeah, definitely. For me, rule number one is what we combat every day in the trauma center. And that's something we constantly tell to our trainees, to our nurses, to our rest of our medical staff, to patients' families. Our goal is to beat death. And unfortunately, sometimes we don't, but we always have the attitude that that's going to be our goal, is to beat death, because that's why we're there, and that's why we're working as much as we can. The second rule is also something that I like to carry with me as well, because we want to make sure that even though medical care is busy, it's difficult, there's a lot of challenges these days, you still have to remember that you want to treat the patient just like they were your own family member. So that's definitely something that I always remember. And I always try to tell the residents and people I work with that, no matter how tired you are, how frustrated you are, you still have to remember that this is family and you have to take care of them. And that was definitely something that Dr. McSwain was very big on, and something that we try to carry on with us as we, treat our patients in the trauma center.
Good, thank you. And the number 2 rule and everything, I always find it fascinating. Again, I think this is something that it's not just every patient, but to treat the people that we meet and all that same and that same passion and everything. So from another perspective, Jared, I'd like you to kind of chime in, because you look at this in a different view, but yet with kind of the same results in there.
Yeah, absolutely. With these trauma rules, these patient care rules, I mean, I've always stated that this is applicable to all parts of EMS, just not trauma. But it's the way we should approach everything as we do. I was just having a conversation with my EMT students, and one of the things I was telling them, was each minute has 60 seconds, don't waste any of them. And it's funny to think that, but when you really sit back and look at how we do care, we can spend a lot of time doing different things. So I was trying to tell them, you need to have that understanding, knowledge, that foundational knowledge of your anatomy, knowing your physiology, where it really ties into it, it's more life lessons, and it's more of just how things are rather than just taking care of a patient. Some of this can be tied into all facets of EMS, not just, like I said, not just trauma. I don't want to repeat myself again, but it's also just, knowing when to treat, knowing when to leave, and different things of that nature. So these rules are foundational for everything. That's how I look at it. And trying to reinstill this into EMS education to help further Dr. McSwain's legacy, throughout future generations as well.
Okay. And Jared, not put you on the spot and everything, but you're one of the few individuals that we have here that probably did not know Dr. McSwain personally and everything, but what you do follow and why you became part of the board and everything was the supporting his mission and visions in there.
Yeah, and Mary and I talked about this a little bit last night after we met. One of the things that it took me when I came to Tulane with Advanced Trauma Life Support as a coordinator was in hearing Dr. Smith and Dr. Stuckey and several other people, even before I met Mary and Will, was trying to understand Dr. McSwain and understand his passion. It took me a year before it really instilled in me what trauma education was. It was as a pre-hospital provider, I always looked at it as we just hand off a patient in the field, but then hearing his stories and hearing his background and looking through PHTLS and ATLS, things that he was involved with the inception of and the continuance was really understanding his mission for the betterment of the patient. I like how Will had brought up, what have you done for mankind today? What contributions have brought into? It's truly, correct. What have you contributed to mankind? And it just struck this nerve with me. That, though I never met this gentleman, I never had the possibility to, but his impact, greatly affected how I proceeded with coordination and then educating, the future of pre-hospital providers in EMS as well.
Good, thank you. And again, I hope all of you have had the opportunity to see Norman's rules of patient care, and he shares them. He shared them with all of his medical students and everything that came through there. And I think that it's a good legacy, and as has been identified, things that can be applied to every day, not just to the trauma patient. Okay. So let's go ahead and, excuse me, wrong button. Let's go to this button here. Let's talk now about what exactly is MTEP. We have, some of you are aware what MTEP is, or the McSwain Trauma Education Project and all, but if we can hear from board members in there, what exactly is MTEP? How's it, what's its operational aspect? What's its goal and everything? And Mary, I think you're probably the best one suited to begin that conversation.
MTEP is it's as its mission states, it's to improve the treatment and outcome of the trauma patient for those who deliver that care, from not only the pre-hospital standpoint, but also to the OR. What happens in the streets matters, and what EMTs do affects those in the OR as well, and that's something to be remembered.
Okay. And I want to go to the next one, because I think that this really speaks a lot into where what MTEP is wants to accomplish. And I want to talk about this before we go into the mission and the vision and everything. And this is from Norman himself, and those of you that know him, I appreciate this. One of his as it reads, one of his lifetime missions is to provide continuing education to pre-hospital providers. I want to develop a new and forever system for such education for our EMTs. Each year, excellent educators and speakers host emergency medical technician or EMT continuing education courses throughout the United States and the world. Each of these courses costs EMT attending around $1,500 or more for the course fees, transportation, accommodations, and other travel expenses. Unfortunately, many EMTs do not attend the continuing education course. They cannot afford the expense in there. And I think that, again, this is one of the driving factors in there for the development or the implementation of MTEP, and try to take this and apply this into a situation. And if we start and look at, if we go and start looking at the mission here, as Mary talked about, the mission of the MTEP is to, again, as it states here on the screen, to improve the treatment outcome of the trauma patient by providing quality continuing education to those who deliver the care, from the streets to the surgical suites. We like to think that this would be a pathway to where continuing education can be applied to all members who has a tendency to treat the trauma patient in there, and learn from each other, and continue this legacy. Other members, other comments from other board members?
I would just say that basically he started doing this kind of thing in New Orleans for the providers that were closest to him, because he knew these guys, saw them every day, and knew that they weren't making it to these conferences. Let's get this thing done. And that's what MTEP is seeking to do in response to this mission, providing these things in people's neighborhoods, so that they can come to these things without exorbitant expense, and the same quality of training can be made available to them. And we're looking at all kinds of different types of outreach. We've talked about sponsored lectureships at state and regional conferences. Whatever we can do, we're going to be looking to take advantage of those opportunities and to build this mission out so that the education comes to the providers.
Okay. Good. Thanks. Well, from the mission, let's take a look at the vision. And again, I think that this kind of summarizes some of the things that's been leading up to here in the discussions and everything. As you can read here on the screen, again, is to provide different opportunities. And we're going to talk about some of the ways that MTEP is trying to reach and provide continuing education in there, on one-day trauma courses, the third Thursday trauma talks, sponsored lectureships in there throughout. And we'll talk about what's been accomplished so far after this. But along with the vision, then let's talk about the goal. And it all ties back into the mission that we talked about, that Norman had initially, to provide that comprehensive continuing education for all providers We know that one thing is that the treatment of the trauma patient, the treatment of any patient care continues to change on a regular basis. And just because we learned it once does not mean that it's going to be that same as you continue throughout our career in healthcare and providing treatment in not just to the trauma patient, but to all patients that we see throughout our profession in there. So with that, let's go ahead and let's talk about the conferences up here. And again, I think, if Mary, you want to speak a little bit here about the overall conferences here.
So we are looking for local one-day conferences. Daddy knew that EMTs could not afford to go to a national conference, could not afford travel expenses to do that. And they were missing out on incredible opportunities for national speaker education. So we bring the national speakers to the local level. So we host local conferences, invite national speakers and work with local speakers to host a one-day trauma conference. And tailor the needs to the individual community. So if your area is doing pre-hospital blood, and that's something that you want to hear about, we will bring the experts on pre-hospital blood to your area. But if you're not doing pre-hospital blood, then it doesn't matter to you. So it's certainly not. We don't have cookie cutter speakers and topics and agendas. You tell us what you want and we will bring that to you.
Okay, good, thank you. So moving on, let's talk about some of the upcoming courses that we have that's already scheduled and everything. And Ms. Madison, if you can address these that we have up here, the current ones that we have scheduled.
Sure. So our very first conference is happening in October on the 14th in Omaha, Nebraska, in partnership with the Metropolitan Community College. We've been working with the team over at the community college for, I would say, about the whole year, since January. And the exciting thing about this conference is it's specifically tailored to the needs of Omaha. So we're bringing in national speakers, but because of the resources they have, we're also doing a lab session with their synthetic cadaver that will allow all of the participants to spend time with their speakers in traditional lectures, but then have a little bit of one-on-one kind of hands-on time in the lab. Our second and very first international conference is happening in Cancun, Mexico. We're partnering with an EMS training center there called ERES. It's going to be their 15th anniversary. We're bringing a good team down there. And again, our offerings are tailored to the needs of the community. And we hope with both of these conferences that they continue annually for the foreseeable future.
Thank you. And we're going to have to, Dr. Gross, we apologize for having to take you, to drag you to Cancun in December. I know, hopefully you'll be able to.
He looks pretty upset.
Good. So, and those are the ones that are currently scheduled. Again, and we'll talk to you about how to find out more about this here later on. But let's talk about the ones that's in the works and that continue to evolve on a regular basis in there. And Madison, again, if you just kind of want to touch base on these.
Yeah, so for next year, we're in talks with all of the locations listed that you see on your screen. Montana, North Carolina, and Chicago. We're nearing an end to kind of scheduling those, but we're still a year out, so things are pending. And then we're looking at a couple of international locations. So right now we're considering Portugal and Brazil. And the idea here is that we're bringing these conferences to places that are underserved in terms of EMS education and just educational resources in general for pre-hospital trauma care providers. And we're always looking for new locations to bring the conferences to. So if you think that your city or state could use an MTEP conference, feel free to reach out to us at general@McSwainTraumaEDU.com.
Thank you. I want to go back. I want to touch base on Montana and go back and talk about something that Mary brought up about tailoring this to the needs of the local group and everything. I think it was eye-opening when we're having conversations with Montana in there when they were talking about they have 4-hour transport time periods and all. This is wilderness medicine. This would be very difficult to bring somebody in to talk about the, somebody that has that's used to a 10-minute time, transport time. Talking to these people are experts in some of these areas here, and tailoring the conference around those that type of individuals or those types of situations in there. So again, I think Montana is going to be an excellent opportunity to do just what Ms. Madison was talking about and what Mary was talking about, is bringing this to the underserved areas in there. Most of the people in Montana, them to go to a conference and everything is anywhere from a 6 to 10 hour drive for them to get to a large conference area.
And Steve, if I may, one of the things in the meetings that you had brought up with Montana is that we should address not the immediate signs and symptoms of shock, but signs and symptoms that you're going to see an hour, 2 hour, 3 hours later. Because when you're talking about the frontier medicine kind of transport time, those are the things that those are the interests that Montana has that very few areas have. So it's an interesting concept.
Yeah, and again, it goes back to one of your dad's patient care rules too. Work with physiology and all, know it, and anticipate what it's going to do. Not know the patient's just in shock, but why are they in shock and what's it going to progress to, and what can we do to help with the tools and instruments that we currently have in there. So, all right, so let's go on and talk about one of the things, the McSwain Trauma Education Project, Third Thursday Trauma Talks, or what we refer to it as T4 in there. It took a while for us to come up with that one. And again, Mary, if I can ask you to just make a few comments on the Third Thursday Trauma Topics.
So every third Thursday of the month, we will feature an expert in trauma on a particular topic. You can see on the website, you will be able to see on the website the topic and the speaker. We seek speakers and experts for particular topics. And we ask the audience for what topics they want to hear. Again, MTEP is about you and the topics that you want. So you tell us what are hot topics in your area, and we will do what we can to put those on the Third Thursday Trauma Talks.
And one comment on there that I failed to put on here too is that each one of these will also have, we're working on having continuing education, EMS continuing education applied for each one of these Third Thursday talks in there, so that we can help individuals obtain some of the continuing education they may need for relicensing throughout their career. Okay, so some of the topics that are at the scheduled program that's coming up here, again, is most of you are aware that there was a revision of the EMS field trauma triage guidelines that's going to be addressed with representatives from the American College of Surgeons. Some more of the topics is military versus civilian EMS, shock and treatment of shock, some of the changes that's occurring and continues to occur with that, and then ongoing assessment and treatment of the trauma patient. Those are some of the topics that are currently already in for the 2 scheduled conferences that we have that are already out there in Omaha and in Cancun.
Maybe Dr. Gross could give us a little taste of what he's going to talk about in Cancun.
Yes. We always like putting him on the spot.
Why not? First of all, thank you for having me to Cancun. To say it's a privilege and an honor is an understatement. But I think the two things, I believe I've been asked to talk about two things. One, interestingly enough, it mirrors something that Norman was involved in several decades ago, and that is the pre-hospital treatment of crush injuries, which I'm not sure has evolved all that much. Having seen some of this in both the civilian world and in the military world, I can tell you that I'm not quite sure that it's a heck of a lot different from what Norman was pictured in doing to a young African-American male under a train many decades ago. So we'll talk about that, and I will also try and revisit the shock and awe, basically the current trends in the therapy and the diagnosis of, and then the treatment of shock today. My thought, Mary, was to compare that to where we were back in that the war of northern aggression, if you would, and see where we've come in the last couple of 100 years.
Thank you. We look forward to having you in Cancun, and we appreciate you being there.
Thank you, Dr. Gross.
Thank you.
Another one that I think Will has one that he's going to be doing is it actually that simple? Which I think is something that sometimes we lose sight of, especially in today's technology world and everything, that maybe there's some simple things that can be done in there with the patient, that sometimes simple is maybe the better out of that. I remember when I first started in EMS, which is quite some time ago, we were doing rotating tourniquets in the field. You know, those were always, that was always a fun time in there. Some of those things that, you know, that we get caught up in, or, you know, the high dose epi things and stuff like that in there. Well, was you going to?
What's that?
Were you going to elaborate? I'm sorry.
I was just, we had rotating tourniquets too. It's like for congestive heart failure patients. That was crazy. It's like, let's keep some of the blood in the extremities. It was nuts. But since you brought up my talk, I will be looking at, like, all the important stuff is simple, you know, so I will be talking about all the stuff that we have at our disposal to do things. You have to be good at the simple ones and be, you know, be prepared to do those and to manage those quickly. And then you have other options to do other things. So that's kind of what my focus is going to be. It'll be broad across the different things we do in life-threatening situations. But look forward to it.
Thank you.
That was cool.
So one of the other ones that Mary brought up was the idea that one of the things that we are looking forward to, and we're actually going to do this in North Carolina, is what we call sponsored lectureships. And what it is MTEP would be seeking to sponsor a Norman E. McSwain lecture at an established conference in there. If you have an established conference, a state conference that you see, it may be something that the MTEP would be willing to help support bringing an individual in on a national topic, on a national trauma topic, and helping secure that individual and their ability to speak at that conference. And again, as we talked about, the first one is going to be in North Carolina in April of 2003, where we'll be working with an established annual conference in North Carolina. Some other things on the horizon out there, and again, I'll let Mary and Will or the other group, you know, talk about the literary reviews that should be coming in the near future.
Yeah, we a bunch of us, you might be familiar with the International Pre-Hospital Medicine Institute, and we do literature reviews monthly. And what we thought we'd do is to bring some of those live so that you guys could see us discussing the stuff that we write about. And the idea being there is just to help people read, see what the science is pointing us towards, why we do some of the things and why maybe we shouldn't be doing some of the things that we do. and discussing the science in a way that's practical. Dr. Pons, who's also works with us on these projects, used to do a lecture on how to read medical literature. Because most people don't know how deep you have to read it. If you just look at the abstract and you know exactly what the authors wanted you to see, you have to read the entire paper to get a sense of how the study was done and if it was somewhat predisposed to a certain conclusion. So it's important to talk about those studies and what they do and what they don't do, or what they say and what they don't say. So I think that'll be a regular feature on the third Thursday Trauma Talks. We stuck with that concept just to add a little extra on there, because I did a thing when I was running an EMT school, trying to set something up so people always knew on a certain day every month at a certain time, they could always come to my hospital. I would be there doing something. They didn't even know what it was. They just know if they came that day, I would have something. We want to do the same thing here. So this is the McSwain Education, this McSwain Trauma Education Project. This is what we do. The third Thursday of every month, we're open for business, and you can come in and see what we're talking about. And we will discuss things. It'll be open, and you'll all be a part of the extended MTEP family. Because this won't be any different than it was when Norman was here and we were all working with him. It's not just project management. It's a family working on these things together because we believe in what we do. And we're trying to create that opening, that window. So every month, everybody, whoever you are, wherever you are, would have a shot at getting in there, picking up some CE, and also talking to us.
Thank you. And I think that's one thing that I really like to emphasize is the idea that one of the things that MTEP, I think, is striving very, very much to do to involve individuals in there. This is not just going to be a talking head type situation. I know we want to interact with individuals. That's how the that's how the best learning occurs and everything. And we want to keep it that way. And same thing with when we talk about our one-day conferences and everything. It's an interaction with individuals. I know, not just regurgitating something sitting out there on a set of slides. So, and again, this is back to again what Mary was addressing in there. What type of education avenues and or topics would benefit your community? Those are what we want to see. We don't know what you need, but what we are committed to is being able to provide you what it is that you need. We want to hear from you, not you hear from us. In there, we don't need to tell you what you need. You need to tell us what you need, and we will find the right people to bring that to you.
We don't know what we don't know, so
we don't know what we don't know in there. Okay, so and again, Mary and Miss Madison, if you guys can kind of talk a little bit about this here and about MTEP in and by itself, because MTEP, again, I'll let you address this fundraising and from the organization aspect.
It's really quite simple. The McSwain Trauma Education Project, the board members, is a working board. And their role, their voluntary role, is to fulfill MTEP's mission. The McSwain Charitable Trust is the fundraising body for MTEP. Its sole function is to raise funds. I'm asking a lot of the MTEP board members just to fulfill the mission. And they don't need to be worried about how that's going to be paid. MTEP, the trust's responsibility is to raise those monies. They're both 501c3 nonprofits with very separate, directly engaged, but very separate responsibilities.
Ms. Madison, anything to add to that?
No, I think Mary covered it. MTEP is the organization that brings the conferences and education opportunities to different communities in the country, whereas the trust solely fundraises for those activities and doesn't engage in the work involved to plan those activities.
Thank you. Okay, so let's talk a little bit about the website. I'm not sure if some of you have probably been out to the website. Hopefully that's how you were able to register for this presentation, everything. But some things about the website, and again, the address is right here at the top of the screen, but there's a lot of information available on this website. In there, there's a tab about Norman for those of you that want to learn a little bit more about Dr. McSwain. What the type of person was is important to us, EMS and patient care. The McSwain Rules of Patient Care is available for download also out there in a PDF form that you feel free to share with that. I know that some places, Jared is one that he prints these off and uses them for his EMS students and everything. And I think that some, again, I think it's still done in some of the resident programs and medical programs in New Orleans. It's still used in there. But again, you can see there's an area in there for conferences, and you can continue to see additional information there on the conferences, the locations, the speakers, the topics, and everything in the way for you to register for those if you're interested in taking with those. And again, it's just examples of what we'll do for you for your local conferences in there. And it's also a way for you to make contact with us in there. So again, I would say that maybe this is something that you don't need to visit every day, but you may want to visit it, once a week, every couple of weeks or so, just to see what new is going on out there and what we're continuing to do. As Mary and Madison were alluding to, we've been about a year trying to get everything put together and get things moving forward. And now that it's moving forward, it is kind of like a locomotive right now. It's really it's going pretty fast. 2023 is just around the corner for us in all essence in there, and trying to get everything accomplished. For those of you that have put on conferences before, know that it takes a little bit of it takes quite a bit of effort and everything. So again, as technology continues, and I'm not the technology buff in there. That's why we have Jared and Madison in there to keep us old people tech savvy. I still write notes in there. So again, something to keep your eye on. And again, as we've been saying all along here, you want more information, contact us. We want to hear from you. What's your local hot topics? Again, and again, even if it's something that you think is small, if you think about it, then it's probably important not just to you, but to someone else. And again, we always like to try to keep some tools in our arsenal in there. We like to have extra topics and everything in there, because again, the plights that you may have, again, are probably not just unique to you. There's probably some others out there that have some of the same situations in there. And I think that we can continue to see themes out there. But the key thing is we want to hear from you. Please always feel free to contact us. In there, there's a place on the website where you can contact us and leave us information, messages, or ask about additional information for conferences, or if you want us to try to work with a partner in your local area for bringing on a conference and everything, please let us know. We want to hear from you. So with that, I just want to take a quick look and see if we've had any. I don't see any major questions or anything in there, but again, I guess I would ask if there's any comments or any questions or anything from the audience that we haven't addressed yet that you'd like us to address before we close things out here this evening. If you do, feel free to unmute yourself and ask your question, and we'll go ahead and address that.
I would just add at this point that you guys are here for, this is it. This is the start. We are just getting this thing going. Spread the word, let people know what we're doing. Let them know that all of the contributions to the trust that you can make through the website are used to fund these conferences and the other endeavors that we're going to get into satisfying these needs. And again, we've given you this list of things that we're going to do now because that's what we came up with in a relative vacuum. You know, our group of people, this is what we think will work based on our experience. Tell us what the next step should be. You know, what else is going on? What would you like to see? What do you need help with? We want this to be the place. And you can do that by letting us know, and you can do that by joining us on the third Thursday and seeing what we're talking about, and then sharing what's on your mind in the discussions that follow.
And just to echo Will, we are a startup. We are just beginning. And so any contribution that you could make, no gift is too small, no gift is too large. But we certainly would appreciate the help to allow us to continue our mission and to educate people from the streets to the surgical suites.
I think Dr. Kramer was getting ready to say something.
Dr.
Yeah,
Kramer.
thanks, Will. Just a really quick comment. And Mary and I had the chance to talk about this activity a couple of months ago. And this is really exciting to listen to all the things that you described. And I just want to thank all of you that have been working on this and the board and getting it going. This is just really cool, and obviously is a testament to the impact that Norman has had on folks, but you all should be really complimented. Nice job.
Thanks, Dr. Kramer.
This is Ken Maddox. May I say a word?
Yeah.
As I've been watching this, it took me a little bit of time to get on, but I've been watching, and I've been thinking, what would Norm really like? Norm liked to chew on those things that are happening, those things that are changing, those things that are coming, and he was always at the cutting edge of new things, or if things were getting stale and old, he was at the cutting edge of criticizing those things that needed to maybe not have started. Norm and I spent light years debating each other on mask pants, and we really enjoyed it. We even changed slides at times, and I would give his talk and he would give my talk, and that attracted a lot of attention. I'd like to throw 2 or 3 things out that are right now very, very hot. There are a number of papers out in the surgical and the trauma and the EMS literature on the futility of CPR, and that CPR should not be done in a trauma patient until the control or in a hemorrhagic shock patient, until the source of bleeding is controlled, and that if you don't control the bleeding, CPR in the ambulance, CPR in the emergency room, CPR in radiology, CPR in the operating room increases the chance the patient cannot be resuscitated. Or if you do get the heart going, they're not going to ever wake up. They're going to have a dead brain. And there's a lot of physiologic reasons for that. So debating the pros and cons of CPR prior to control of the bleeding from the heart, the aorta, or whatever, you actually increase the bleeding. There's a big second item. There's a big debate on the mechanical devices that aid the paramedic, aid the emergency physician, aid in the patient with COVID once it's indicated, like a medical cardiac arrest, giving that pump to the heart. So the pros and cons of those external devices, thumper and on and on and on. They do increase rib fractures. They do sometimes cause rupture to the heart. And so having that dialogue causes people to sign in and say, what's hot this week? I was really, third item, I was really struck by a cab that I saw in Dubai. You called the cab and it showed up without a driver. As a matter of fact, it was a drone. and you climb into the drone, you tell the drone where you want to go, and off it flies. They are now making mock-ups of an ambulance that you call an ambulance, and an unattended ambulance drone shows up, and whoever ordered it puts the patient into it, says, go to such and such a place, boom, it's gone. I predict that in 5 to 10 years, most ambulances are going to be drones. Whoo! Think about and they're going to be unattended drones. Think about what impact that will have on EMS. And Norm would be right at the top of that, trying to be part of it. I even saw a write-up and even a presentation on a drone the size of a bathroom, a little bit larger than a bathroom, that would contain a Da Vinci device, and that the technicians aboard would put in probes, and then one could operate from anywhere in the world as one would do a laparoscopic control of hemorrhage or whatever. So I've listed the 4 things that I see on the horizon, and that Norm would have been giving lectures on the pros and cons of those various concepts. Coming down the line is also a criticism of all vasopressors in the trauma patient. Epinephrine is going to be out, and the use of ketamine as an anesthetic is going to be out. And all one has to do is a quick search of the literature, critical care literature, and a deep criticism of vasopressors. Whoo! A couple of those things would shake the very foundation of what started as EMS, and we would define resuscitation as an elevation of blood pressure. Resuscitation may be actually lowering of the blood pressure with very different goals in endpoints of resuscitation than what we have had sacred. So my suggestions are to stimulate participation, to stimulate contributions, keep things hot, keep things controversial maybe, and have some pros and cons, maybe debates. And thank you for letting me share these provocative thoughts with you.
Thanks, Dr. Maddox.
Thank you, Dr. Maddox.
Dr. Maddox, you're if anything, you're provocative. And so to your first topic about the futility in CPR, Daddy would say dead on the scene is dead in the hospital. And so we also look forward to inviting you to our next conference or conferences to talk about your hot topics that you bring up. And they are very interesting. We appreciate it. And thank you for being here.
I don't know all the answers. I know a lot of questions.
That's all right. You're a good person to take the opposite side. And we do pros and cons in our conferences. It's very stimulating for the audiences to do pros and cons, and certainly appreciate you bringing that up. Thank you so much, and thank you for being here. You're just awesome.
Thank you. The other thing I would like to also make an offer in there that if any of you are interested in also participating in these conferences as a speaker and everything, and you have your areas of topics and everything, please send that to us. We would love to have you. We see a lot of good friends, past friends out there that I think would be very good. And as Mary alluded to, Dr. Maddox has never been controversial in anything that he's that has been presented and everything, but I love the topics. Thank you all for being here. As we wrap this up, what I really want to leave you guys with this here, and again, back to something that Will said earlier, and it's been said in there. A lot of people didn't understand when Dr. McSwain said, what have you done for the good of mankind today? That was not a greeting. That was a challenge in there. And to be the best that you can be and do in there. And I think, again, that it just epitomizes everything that Dr. McSwain stood for in there. Again, so again, you'll see this out on the website and everything in there. But again, I want to thank everybody that's had all the people that participated here this evening, all the board members and everything in their thoughts and comments through here, and the audience too, in your thoughts and comments in here. Please stay in touch with us. Please let us know what we can do to assist you. If there's an opportunity for us to provide something for you, please let us know. If we don't have it, we'll get it at all. We know a few people in here, and again, we like the challenge of stuff in between there. So again, on behalf of all the members of the McSwain Charitable Trust and the McSwain Trauma Education Project and everything, I want to thank you for your attendance this evening in here. And again, please stay in touch with us in here. And again, I would open up to any comments from anybody as we close out.
Steve, I just want to make one comment. I think that we're launching MTEP on the perfect day. It's been 7 years since Daddy's death today. And I think that it's very appropriate that we start MTEP and continuing his legacy on he may be gone, but his legacy continues and his passions continue, and we will make that happen.
And it looks like there's a question from Caleb Boudreau. Did you all see that in the chat?
Yeah, I was just getting ready to respond to her and everything. But again, definitely the Thursday trauma talks, we'll try to address everything. They're not just limited to EMS individuals. Unfortunately, that's the only ones that we can actually provide continued education for. Providing continued education for physicians, nurses, PAs, and everything is very, very difficult at best and everything. But again, the topics are relevant to all of those individuals in there. So again, always feel free in there, regardless of what your status is as a medical student. And I think that both Dr. Smith and Dr. Stuckey will tell you also that those talks will have relevance to the physician as well as anyone that provides care to the patient. Remember that we're all members of a team taking care of these patients.
Yeah, I would say from just like Norman would say, from the street to the suite, everybody is welcome in these discussions. And hopefully we see it all.
Well, and the other thing too is that, it's always great to hear a different perspective and everything. We have paramedics perspective, a surgeon's perspective, an ER physician's perspective, a nurse's perspective. They all have to work together and everything for that patient to get the best of care in there. So again, we need to involve everyone in there, have everyone involved in that discussion. Okay. With that, unless there's some other any other comments and everything, again, thank you for your time this evening. And again, we hope to see you in the future, and welcome to the family in there. And let's continue to do good out there. Thank you. Dr. Maddox, did you have your hand raised?
I really didn't mean to raise my hand,
Okay,
but let me remind you of something that's happened in the last 2 years. With COVID, interpersonal violence has increased. And the group that are here are the first to arrive at places like the Webb Elementary School out over in Texas. So having subjects on disaster, what to do when you come upon a scene in the Texas school shooting, a lot of those patients were arranged to then, they had one hospital in town, and most of the bad cases were transported over to San Antonio. And so what goes on, what a paramedic medic should do, and maybe even a whole new redefinition of what is the field, and others are joining the allied health classification. Both nurses, PAs, in some places, physicians are scooping in on pre-hospital care and are mandated to ride in the ambulance. So redefining the roles, redefining the task would be an awesome thing for this organization to sort of take on.
You know, Ken, I sent this to Jared earlier, but Nicholas Sen is the surgeon who founded the military association, the Military Association of the United States, and he is quoted as saying, "The fate of the wounded rests in the hand of the one who applies the first dressing." I'm paraphrasing it, but Norman knew that. Will knew that. I think Jared has learned that. Will and Norman putting together PHTLS and your comments today, this evening, with the redefinition of care in the field, given what we've seen in the last few years, I think you're spot on. And I think Mary reminding us all that today is the day that Norm may have left the earth, but he has not left us. I think that this organization, all of you who have put this together, it's a testament to Daddy, and it is going to make a lot of difference in the lives of those who we care for. So I want to thank y'all.
Thanks. Thanks, Fred.
Thank you.
Thank you, Dr. Gross. It means the world. Thank you.
All right. Okay. With that,
Adios.
Thank you, Dr. Maddox. You're awesome
Stay
as
well.
always. We'll chat soon. Dr. Cromer, thank you for coming. It's been a pleasure having you here. And Dr. Gross, you are always just a pleasure to be with. Thank you so much and thank you for everyone for coming. And Steve, thank you for being such a great host.
thank you.
Good night. Stay well.
Yep.
Stay away from
Thank you.
monkeypox.
Yep. All right.
We'll try.